intelligence. So it started for me 3 years back with the local access network. It's called LAN, and it is also having a wireless connection too. So this is one of our publications in the February 2021 issue, where we interconnected all the ophthalmic gadgets at our fingertips to export maximum data. So especially when the COVID happened, it was actually a crisis, but we made sure we actually innovated during the crisis. So this was a cubicle that we innovated and kept all the machines inside the cubicle to create a physical barrier between the patient and the doctor, especially when the doctors and the paramedicals were afraid to start after the first wave of lockdown in 2020. So I call it the marble infinity stones, where when every stone is interconnected and the gauntlet yields a tremendous power to the one who wears it. What we did was we interconnected all the machines to the local area network, and every data was interconnected to a computer, so that wherever we are, it will be at our fingertip through the computer, which was positioned very close adjuvant to the slit lamp inside the cubicle. And this wireless is also possible, or with wire also you can go ahead with it, depending on what is your comfort of local access network. And we did a simple screen mirroring, so that any mission that we want to, we don't need to go to that mission and use it. It comes to us. We can choose any frame of choice. The fundus zooming is possible. You can use different filters. And for example, you can see a case of progressive open angle glaucoma. In this video, you can see in the place where I am currently sitting near the slit lamp, the machine can be accessed. The fundus right eye, left eye, zoomed examination, comparative side-by-side examination, a red-free filter. If I want to see the patient's visual field, simultaneously through my Google Chrome, I'm opening the visual fields of that patient. The past 6 visual fields of that patient can be opened side by side, and the comparison can be made. Again, similarly, another case of optic disc pit with CSCR, even the OCT also can be integrated, not only the fundus photo and the OCT, even the visual fields. And again, here you can see the OCT, the different slices of OCT. With EMR, we may get only a single slice, but here you can see different slices of the OCT is got. And what we did was, in the server in the hospital, we connected our laptops with it through an AnyDesk or a TeamViewer. You can see here in this video, here where at home, the doctor is accessing all the files that is present inside the hospital, be it accessing even a biometry file that you want to access, or be it a structure function correlation assessment in glaucoma. So this really helped us tide over the COVID first wave and second wave to a certain extent, where doctor safety was also ensured along with paramedical safety. In this case, you can see a structure function correlation comparison being done. So it has an edge over EMR, because in EMR it has a fixed frame module, whereas with the LAN connection, what we did was, you can access any frame of choice that you want. And even with the telecommunication can be established even in a simple smartphone as well. So wherever we are, that particular case history with the MR number that you know, we can access the fundus, we can access the OCT. And in this patient, disc coloboma, fundus was examined, and then a simultaneous OCT of that same patient is examined in different slices by the doctor from her smartphone itself. So this is another publication in December 2022, last year, fag end of last year, where we had an invited commentary on it. What the eye sees, let us make the world see. So that's the smart evolution of teleophthalmology, my dear friends, where we are now moving towards 3D teleophthalmology or 3D EMR, where we are trying to devise novel 3-dimensional case sheets for neuro-ophthalmology, or be it for ophthalmology as well, anterior segment imaging, posterior segment imaging. So I feel 3-dimensional case sheets with augmented reality is very much around the corner. I think it should happen any time around. Even counseling in 3 dimensions is going to happen, where e-counseling with the patient's own image in 3 dimensions. It's just a matter of time before every individual cases will be generated in 3 dimensions, and the case sheet also will be generated to the patients in 3D itself. And here again, this is a 4D technology which recently we have innovated, where with the headset, even 4-dimensional examination of the patients in a splinter hemorrhage. You can see my friend on the right, he appears to be moving through a thin space, but actually he's examining the patient's case with the help of the 4D, that is, we brought in the touch technology as well. You can touch it, you can spread it out, and this is a workflow of the new software that we have innovated, where a patient walks in, you do the fundus and OCT, it goes into the hospital database, and our translational software labeled as IMG 4D converts it within 60 seconds into a 3-dimensional case sheet. So this is a diabetic retinopathy with macular edema, Before treatment, you can see we can extrapolate the OCT from different slices and we can actually show the patient, which is now possible in telemedicine, multimodal imaging of the retina, different imaging filters is possible, low vision rehabilitation, counseling, even neuro-ophthalmology, telemedicine, or even for simple teaching like a pedagogical tool is very much possible. And I feel it's only a matter of time where we are going to transitioning from a two-dimensional telemedicine to a three-dimensional, and if not a four-dimensional telemedicine in the future, where in the Hollywood movies the doctor is in a place and the patients are in another place, but we can actually touch, feel and do a clinical examination which is just round the corner, is according to my opinion. So I think COVID really brought out all the innovations out from me and my research team, and we really feel that crisis really brought us out with all these things. And to add on to final touch of artificial intelligence along with the augmented reality, we all doctors work along with the mission for a better humanity. There is not going to be any substitute of the machines. The machines are never going to overtake the human intellect. The human intellect will always be on the top of the chain. The artificial intelligence is just going to make sure that it's going to help screen the patients to an extent and help assist telemedicine, where we have taken a novel project of human annotations, where we annotate a fundus image through an extreme extrapolate level so that the predictions are well arrived with the human in the loop learning. Rather than just giving the machine the whole power, we make sure there is a two human interfaces of annotation and prediction, so that you can see an image of a diabetic retinopathy like this is not only diagnosed as diabetic retinopathy, but it is also annotated and in multiple levels. You can see in this figure here, not only the image is annotated as diabetic retinopathy, but it is every part of the diabetic retinopathy fundus is predicted by the machine to prevent the black box. Regretting for me taking, I'm just jovial note for taking ophthalmology.
Would you like to have some few words?
So it's always a treat to watch his means innovations, and they are never one dimension. They are always three-dimensional or four-dimensional. So I'm waiting what else is about to come through his box of Pandora. So all the best
Thank you,
for the success of his innovations.
Thank you, sir.
And we would be happy to do a multi-centric trial and
Definitely,
be a part
sir.
of your innovation.
Definitely.
Thank you.
Sir.
Thank you so
Thank you, sir.
much.
Thank you, sir. Thank you. Thank you for the opportunity.